Hello, my name is Dr. Andrew Ferber, and I'm the Chief Medical Officer at Myself Wellness. I see every patient for a psychiatric evaluation before they are approved for ketamine or not. I almost always help them realize that they've come here because something in them wants to be different, and something in them is preventing them from doing what feels natural for them. I've been a psychiatrist for 64 years and a meditator for 50 years. Almost everybody has been brought up to not love themselves enough. I've seen maybe 1,000 patients in my 4 years here. Some see something on a video, some hear it from a friend, some read about it, and something in them says, oh yeah, I ought to try that. Trust your feeling. You can't think your way to it. Ketamine was originally discovered maybe 60, 70 years ago as a non-toxic anesthetic. Got used for animals all the time, in battlefields. Emergency medical techs use it all the time because it's so safe. People noticed that it let them be more relaxed and more loving and more spontaneous. Exactly how it works, nobody knows it all. You will read many scientific papers which are accurate descriptions of what's happening to this molecule or that molecule or this part of the brain or that part of the brain. You're lying there and the movie comes from your head, and it doesn't matter whether you're aware of it or not, or whether you can figure it out or not. It's just being there while the movie floats away that seems to be essential for the healing. And the things that are active blocks that the ketamine lets go of are almost all depression, which is an active protective mechanism of the thing that says what I need to survive isn't here. That's why people get depressed when their loved ones die, when they lose their jobs, or when they've had a childhood where they weren't loved enough. And this is not an either-or thing, it's a gradation. There's probably not 10% of us that have had as much love as we really need in childhood. Our most wonderful healings are with complex PTSD. That's the label that they put on people who've had a mixture of not enough love and too much violence and threat in childhood. Something happens in a person that they say, I don't have to carry on like this anymore. That's the intent. And they take the ketamine and it lets go. It's not just depression and PTSD. We've seen people have tremendous healing who've had autoimmune diseases, chronic pain syndromes from all kinds of chronic illnesses, things that you wouldn't expect the ketamine would help with, that it should make it worse if it's not making the brain better. But somehow, by giving more energy, by letting go of your blocks to your energy flow, many of these things feel better. Our setting here is a really amazing healing organism. Everybody loves each other, takes care of each other, and is growing in their own way. Depression is not a molecular problem in the brain. Almost everybody says, I've tried a dozen SSRIs, they don't work, blah, blah, blah. It really does something that no other medicine does.